This morning, the CDC is reviewing several dozen reports that teenagers and young adults may have developed a heart condition after getting vaccinated against COVID-19. While the agency has not determined whether the vaccine caused the condition, it is alerting pediatricians to be on the lookout for symptoms. The cases seem to appear about 4 days after some teenagers and young adults received their second dose of the Pfizer or Moderna shot. Dr. Mobeen Rathore is a professor and chief of infectious diseases at the University of Florida College of Medicine and joins us via Zoom this morning. Good morning, doctor. Always a pleasure to have you on the show.
Good morning, Jennifer. Thank you for having me.
So this heart condition is something called myocarditis. What is that?
So myocarditis is really the inflammation of the heart muscle. And this is a condition that we see in about 2 to 4 cases per 100,000 population, general population. And this is also something that has been associated with some other vaccines, rarely, but it has not been associated more than what it would be considered the normal background incidence and prevalence of myocarditis.
So that said, what are symptoms of this?
Well, I think symptoms could be different. You could have some difficulty in breathing. Your different parts of the heart may be affected differently. The heart may swell up a little bit. And so, many times it's just mild symptoms. It can also be very serious at times. So I think it's the effect on the heart is a spectrum from very mild, where you are not that ill, to severe, where you can be extremely ill.
Has it, in these cases involving the few dozen that have been reported, has it been permanent in these teens and young adults that you're aware of?
So far, that what I have seen, and CDC has not put out their data, but on our listservs, what we have seen is most of these young adults have done well. I think it's important to mention, Jennifer, that we see myocarditis involvement of the heart with COVID infection probably much more than we would anything with the vaccine. The second important point is that we know that this it's a huge may be related, and the CDC is on it. They're looking at it. They're going to investigate it. So I think that's the positive end of it, that we are going to very soon find out whether it is directly related or not, and whether the incidence is higher than what you would see in otherwise general population. The only thing I would ask CDC is actually, now, first of all, this has been seen in most of the cases. I think all of the cases are more than 16 years of age, and the vaccine has not been approved for 12 to 15 years of age. The difference I would say right now is that's important that the CDC recommended that this vaccine, the coronavirus vaccine, can be given at the same time as the other childhood vaccines, as opposed to the recommendation for the adults is that you have to have a 14-day difference between the two. So I would be very interested in knowing from the CDC, as these cases, were these vaccines given at the same time as the other vaccines, or did they have the 14-day interval? That is how the vaccine was studied, and that's what the recommendation. I'm not saying that that's what the cause is, but since the recommendation is different than how the vaccine was studied, I think it's extremely important for the CDC to look at that very quickly and say it was not due to co-administration, or if it was due to co-administration, so people can have confidence that we can use the vaccine in a manner in which it was not studied in the studies that were done by Pfizer.
Dr. Mobeen Rathore joining us. Thank you, doctor. And so in understanding, of course, what the doctor is saying is there any kind of correlation associated with the administration of the COVID-19 vaccine at the same time as other vaccines that children might receive, or young adults? Certainly much more to be discussed here, but the bottom line is making sure that you as a parent have a conversation with your pediatrician about what we now know, and have that conversation to determine when is the best time to have your child vaccinated.
No direct association has been determined so far.
Thank you, doctor.